So it's interesting the way this question is asked, because in fact, one of the biggest ways to engage patients in their cancer care is by ensuring they're engaged from the very beginning in the decision-making process. So shared decision-making essentially is incorporating the patient's values, preferences, and goals at the time of any critical clinical decision. In cancer, we typically think about that as a treatment decision. So a treatment choice may look very different based on if a patient, such as my father, when he was being treated for a locally advanced bladder cancer, wanted to avoid certain toxicities or maintain a different level of function versus survival at all costs. So engaging the patient in that process and systematically understanding their values, preferences, and goals and the benefits versus risks of treatment is crucial. And Doug Blaney and colleagues' recent paper in JAMA Oncology illustrated that that was in fact one of the key attributes uniquely differentiating high-value cancer care delivery in practices versus intermediate or low value. We also know that carrying that forward across the rest of the care continuum into patients on treatment, post-treatment survivorship, and even end-of-life care becomes just as, if not more, crucial. So engaging patients in reporting their own symptoms systematically, since more than half are typically missed by the cancer care team, is crucial as well. Same in survivorship. Patients being engaged to report on their symptoms in post-treatment survivorship in lung cancer, in fact, showed an improved time to diagnosis of recurrence and got that patient back into care sooner. So those are just some of the ways. We have lots more work to do on the primary cancer care delivery science side and implementation science side to turn this into scalable practice strategies. And that's one of the challenges that the cancer care community has, that using systematic and best practices and applying people, process, and technology will help.